it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'm going to be talking about my main video, which is on empathy in healthcare. Now, in this video, I'm going to talk about four main parts. What is empathy? I'm going to explain about the definition of empathy. Then moving on, I'll talk about the types of empathy, then the importance, and lastly, the three main parts and the ways that doctors can help patients with empathy. Firstly, what is empathy? Now, empathy is the ability to understand and share the feelings of others. Let's say I understand what my friend is going through. I understand their emotion, their response to that, and using that and taking advantage of that, I am able to calm them down if they are nervous or anything in that situation. It's the ability to understand and share the feelings of others. Speaking of which, there are three types of empathy. What are those three types? Affective, somatic, and cognitive empathy. Affective empathy is the ability to respond to another people's emotions appropriately. So for example, I don't respond to that person's emotions inappropriately. Like when they're in a sad situation, I won't laugh or I will put a huge grin on my face. Why? Because I need to have the effective empathy. I need to show them that I understand their feelings and they'll be more comfortable with me, especially if I'm a doctor to be. Next, we have somatic empathy. Somatic empathy is the ability to feel what another person is feeling. Now, let's say, back to that example. A person, my friend, is mourning the loss of a loved one, for example, and I'm able to feel what they are going through. I know that mourning, period of mourn that they are going through, their sadness, and how much that influences them. That is somatic empathy. Cognitive empathy is the ability to understand someone's response to a situation. The combination of both. That is cognitive empathy. Importance of empathy in healthcare. Well, firstly, empathy fosters trust, and then it also helps patients to cooperate better with the doctor, and the effectiveness of the treatment will be better. This will lead to improved patient outcomes and patient satisfaction, which will make a good reputation on the doctor at the hospital they're working in. And knowing that, I need to know the ways that doctors can help the patients. There are three types: communication, physical comfort, and emotional support. Now, communication. What is communication in empathy? Communication skills. I use communication skills that I have learned, implement that into empathy. So firstly, communication is listen carefully. The ability to listen to others, what others are saying, and their thoughts and emotions. Use clear and respectful language. I must use clear language so that the patient will understand what I'm talking about, and they will hopefully be able to calm down in that situation. Encourage some questions so that they can give more information to me on what they're feeling, and that way I can get more notes and have better treatment plans. Introduce and explain my role. Now, as a doctor, it's my role to explain and introduce who I am. What is my role in their treatment? Physical comfort. So physical comfort is like being in a comfortable environment. Let's say it's a Saturday morning and you want to be in bed. That's physical comfort, with all your pillows and the nice air conditioning in the room, with the blackened windows, blackened curtains, and you can sleep however time you want. That is physical comfort. So back on the topic, we have I need to offer seating and privacy. Make sure that the office or the room is clean, tidy, and have pillows, blankets, and other items. So just make sure that the room or the office is a comfortable environment. Good, suitable temperature, clean, and well lit. Those are the 3 main factors. Emotional support. So firstly, relate to them. I need to know, put myself in their own shoes, look from their perspective, what they're experiencing, and relate to them. Share, for example, I can share with them my own experiences of what they're going through, or just talk to them about giving out some stories to help them calm down, or anything that will help them calm down. Be patient and understanding. Now, as a doctor, I must know how to be patient, listen to my patients, and be understanding. I must see from others' perspective, like I said before, and help them connect with their friends, the patient's friends and family, so that they have someone to hold on, someone that they can trust to hold on. Use nonverbal communication like body language, hand gestures, eye contact, things like that, so that they know that they are in good hands and they can be able to trust me. Don't make them feel intimidated. Now, it's also my role to not make my patients feel intimidated by my role. I know I'm a doctor and that's a very well-respected role in the community and the society, but don't make the patients feel intimidated by you. Don't be a show-off. Don't just intimidate them by who you are. You need to know how to make them calm and comfortable. And that is all the things I have to say for my main video. What is empathy, types of empathy, the importance of empathy, and ways that doctors can help patients with empathy. And if you have any other questions or any other ideas you want to add into my video, then I will be glad to hear it. Thank you again for listening to my video, and I hope to see you in the next video or the next meeting. Goodbye, see you later.